Okay. Okay. Dad told me you were fasted last night in prep for your surgery this morning. Are you starving? Hello. Hello. Oh, you're very excited. Okay. All right. We're going to do a full physical exam on you prior to surgery. Okay. So we're going to go from your nose to your toes. Hey, can you sit? Can you sit? Very good.
Boy.
Very good. Let's look at those choppers. Let's see.
Open your mouth.
Good boy. Let's look. All the way open. Very nice. Very nice, wiggle butt. Okay. Okay. You've got some scratches on your nose and a little owie on your ear. Sounds like Dad's telling me you got into a scrap with a big sister, huh?
Yep.
Yep. Looks like it's healing. Ooh, it looks like it's healing pretty well. Oh, I'm losing it. There we go.
There we go. Starting to calm down a little bit.
Yeah. Any coughing or sneezing?
No.
No?
No. He's just very hyper. He's always wiggly.
Good. And now, are you working on some training? It sounds like you said he'll sit when he's calm.
Yeah.
Hi, you working on anything else?
That's about it. One of my daughters is trying to do a few things, but she definitely needs to be more consistent.
Manners are important, aren't they? Manners are important. You got to be a good boy when you come to the vet and when people come to visit. Yeah. Let's listen to your heart. Yeah. Hey, good boy. You're very friendly. You're very friendly. I got to look inside your ears too. I felt the owie on your outside. Perfect. I don't hear any murmurs and his chest sounds nice and dry. Hey, come here, sweetheart. Ratchet. Ratchet. Cum works pretty well. All right. Hold on. Let's look inside there.
Good boy.
Good boy. I know you're so excited. Nice and clean. Now when we anesthetize him to perform the neuter today, I will look into his ear canal with an otoscope so we can see all the way down. Dogs have very long ear canals, and so just an outside cursory glance is not really enough. We need to look all the way down into that canal and visualize the tympanic membrane.
Okay.
Hi, that's just like you and I have a tympanic membrane that vibrates and causes sound, so we want to make sure hearing's okay. Weight is good. Devin tells me that you're not really good at measuring how much he's eating. His body weight is really good right now, but after the neuter, his metabolism will slow down quite a bit.
Okay.
And he may tend to chunk up a little bit. Is he on a puppy food right now?
It's on he's on a Purina puppy food.
Okay, so I like puppy food until about 8 to 9 months.
Okay.
Unless, if you neuter really, really early, you may want to switch over to a more adult or at least a lower calorie food. Okay. But it sounds like you'll be doing puppy for a little bit longer, especially with him being this active and being an outside dog.
Yeah.
Yeah. Okay.
Will he start to calm down some after the neuter, or maybe not?
You know, I wish I could promise you that, but no. You know, testosterone is the hormone that we're eliminating when we do the neuter, and so sometimes that calms them down a little bit, but I can't make any promises. It's really all about the behavior. Okay. You really have to do the training. Right. Some of them do slow down a little bit, but lots of these behaviors are learned. The leg lifting behavior, that oftentimes has a lot to do with what they've learned. Okay. So not a lot to do with their maleness. Yeah, okay. Their maleness. Hi. What a good
Yeah, because he hasn't started lifting his leg at all.
Good, good, good. Any limping or lameness? He's an active boy, but have you noticed any trouble?
No.
It's okay.
When he was younger, he was extremely uncoordinated, so he just was funny to almost watch him run because he'd fall over a lot of times. But since he's kind of grown and gotten a little bigger, he seems to be doing better.
Think about him like a gangly teenager, kind of.
Yes, very much.
Good boy. Yeah, you're doing awesome. Yeah. Feel your tummy? What do you think? And so he hasn't had anything to eat today.
No, his last meal was about 6 o'clock last night.
That's perfect. Anesthesia can, just like in people, can make us a little bit nauseated, so we want him to have an empty stomach when we do our procedure. Both testicles are palpable, so that's good. Good boy, you look ready to go. So you've done vaccinations already. Sounds like you've done some at home, and that's fine. I would like to recommend to you one more booster.
Okay.
The distemper parvo combination booster. There's two benefits. Now that he's a little bit older, it's going to be more effective. It stimulates the immune system. And the other reason is when, I don't know if I can say this, the company that we use to administer this vaccination will actually guarantee and pay for portions of the treatment. Let me start over.
When it's done with you?
When it's done with us,
Okay.
using that particular vaccine, the company will guarantee the product against him falling ill with this virus. So should he develop parvo, you'll have a portion of your treatment paid for by the company since they guarantee the vaccination.
Okay.
So that would be a good reason to booster it. The other vaccines that we'd like to do, the rabies vaccination, of course, is a requirement in Pima County. The vaccine that we give today will be good for a year.
Okay.
Next year when we booster that vaccine, it will actually be good for 3 years.
Oh, okay.
So the very first time is a year, and then every 3 years after that.
To get him licensed, do I do it or do you guys send it off?
So we're gonna give you a certificate today, and you have two choices. One, you can go onto the Pima County government website and fill in all of the information using the piece of paper that we give you, the certificate that we give you. Or your other option would be to take that certificate down to the animal control facility on Silver Bell and fill out the paperwork in person.
Okay.
They'll give you a tag at that time. One of their new policies is they're only giving you one tag, and so that tag will be his for the lifetime. So you won't
okay.
get a new tag every year anymore.
Okay. And if he were to lose the collar, I mean, he's an escape artist. He gets out of everything.
So that's a great question, and my best recommendation for permanent identification is to microchip him.
Okay.
So we have a microchip. We use the company Home Again, but it's a little microchip. It's a little chip. It's about this long. We place it in between the shoulder blades, just subcutaneously, so underneath that loose skin. And that way, if he's ever lost, turns up at the Humane Society, at PAC, or any of the local clinics that have a scanner, as a lost dog, we can scan over that microchip and the number will come up, and then we plug that into the system and they give us your information.
Okay.
Or they'll call you directly. Different companies do it a little bit differently. But that's what I really love about microchipping is he can't get it out, a tattoo may fade, tags may fall off, that microchip is forever. It's not like LoJack. It's not like a beacon. You can't call me and say, hey, turn on the beacon. But if he shows up somewhere and we scan him, we'll be able to successfully return him to you.
Okay.
Microchip pets reach home 35 to 55% more than unmicrochip pets.
That sounds like it's really worth it.
Yeah. It definitely is. We charge $24.99, and that includes the placement of the chip, and then we do all the registration for you. So
Okay.
it's for the life of the pet. You do have the ability to change your phone number or contact information at any time through the company. But
Do they
it's,
keep like vaccine records in that chip or no?
they don't.
Oh,
No,
okay.
they don't. It's not like, you know, sort of wish we could talk about putting medical records in there so they would know all your major illnesses, but it's strictly a number, and that's for your protection. They keep your information safe,
Okay.
and there's no other medical information.
Okay, that sounds great. I think I'd like to do that.
Yeah. And then I know Devin talked about heartworm prevention with you a little bit. I'd like to just reiterate that we haven't seen a lot of heartworm in Tucson. We don't have a lot of mosquitoes, but the truth is in 2013, Twin Peaks Veterinary Center diagnosed heartworm 3 times. And already in March of 2014, we're on our 4th case. So we are seeing more. The University of Arizona has done some studies. The coyote population is a reservoir. They are positive for heartworm. They are carrying this disease. So what happens is a mosquito bites an infected dog, takes some blood that's infected, it goes through a life cycle or 2 in the mosquito, and then that mosquito bites your dog and infects your dog. So prevention is simple. It is a monthly chewable tablet. It's fast, it's easy, it's safe, it's relatively inexpensive for a dog of this size. You're probably in the neighborhood of $6 to $7 per month.
Okay.
The added benefit is it's a routine dewormer, so you're eliminating roundworms, hookworms, whipworms, a lot of those intestinal parasites that you can pick up running through the neighborhood and going to the dog park and
Drinking
those
in
kind of
puddles
places.
and
Yeah, drinking in the puddles. So heartworm disease we are seeing more and more, and prevention is so much easier than treatment. Treatment is dangerous and it's expensive, and we'd really rather see you do a monthly chewable treat and have that bond with your pet.
okay, great.
All right, well, he looks like he's getting sleepy and ready for surgery. We haven't even pre-medicated him yet, so
He decided it's nap time.
yeah, it's nap time, so we're gonna proceed with the neuter.
All right, fantastic. Thank you, doctor.
You're welcome.